This dental phobic patient was referred to us for endodontic treatment of tooth number 29. According to the patient, the crown is 6 months old, and a few weeks ago tooth started to hurt and pain had been getting worse progressively. Her dentist had adjusted the occlusion a few times with no help. Patient said tooth was sensitive to hot and cold and to touch and biting, chewing on. And also patient said that the tooth felt larger and loose. So these are all signs and symptoms of an infection now, an abscess tooth. At some point, when the tooth was sensitive to hot and cold, the pulp was still vital, but it was going towards necrosis. And now that the tooth feels loose, and according to the patient indicated that the tooth felt larger, that usually means longer. And that's because of the fluid buildup, of the purulent discharge buildup, pushing the tooth up and then also causing mobility. Anyways, so we diagnosed the tooth as a necrotic tooth with acute apical abscess. And we went ahead and recommended, of course, endodontic treatment versus extraction. We discussed all of that, and patient said that she wanted to try to save the tooth, and that's what we did today. Went through the porcelain crown. There was no damage, so patient can keep that porcelain crown. There was one necrotic canal, and take a look at the post-op. And here's the post-op. As you can see, everything went beautifully. We went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration. This was kind of an emergency for two reasons. One, that of course patient was in a lot of pain, and that was one emergency. And the other emergency was that patient is flying to India, country of India, tomorrow. And she's going to be there for 10 days. She'll be back in 10 days. So she didn't want this tooth to flare up on her and start giving her issues and problems in India. So she wanted the tooth to be taken care of. And we actually had done, the patient was referred to another endodontist, but patient had declined. Because we had done 2 root canals, 2 endodontic retreatments actually on her husband not too long ago, just a few days ago. And the husband had such a great experience that told his wife, the patient, no, you don't want to go anywhere else. Schedule an appointment with this guy. So that's why she came to see us, and we were able to take care of her, do this root canal for her, and hopefully she'll have a fantastic time in India, and she'll be back in 10 days, and her dentist will just replace that temporary filling with a permanent filling, and that should be it. The crown, as I said, the crown is fine. And the tooth will firm up over time. It just takes, because now that we remove the source of the infection, necrotic pulp tissue and microorganisms and their products, now the infection will go away and the tooth will firm up over time.